Hello everybody, welcome to another live YouTube on the Auburn Medical Group channel. We're glad to have you here. Oh, there's water on the counter and I'm splashing it everywhere. Glad to have you join us. For those of you who have never seen this before and are watching it after the fact, this is a live video when it's done, but not if you're watching after the fact. But while it's going, there are people writing little chat messages in that I'm responding to, so that's why it seems like I'm talking to someone. It's because I actually am, and so it's really a live exercise, but we do try to, after we get into it a couple minutes, jump ahead to 2 minutes into it if you want to see what the topic is about when I really get going on the topic. But we'll be talking to people like who's joining us here. We've got Christy Sipes. Good evening. Yes, good evening to you. Jay Cordano. Sardano. Hello. And M. Retfors. Boy, I'm having trouble reading. I'm sorry. The Best. Hi. Faith O. Hi. Jay. Hi. Bonnie Rodriguez, hello. Bernadette Blair, good evening. Faith O. And Deshone Leggett, hi, Dr. Vaughan from Fort Leavenworth, hello again from Fort Leavenworth, Kansas. Jose Luis Lozano is saying something, I think, in Spanish, maybe in Portuguese. Lisa Smith, it's raining in Florida. Oh, okay. Sarah Pena, hello. And Retfros in Colorado. Jay Mad is saying hi. Brianna McMillan is from Arkansas. And so, Brianna, do you call yourself an Arkansasier or do you call yourself an Arkansan? That's the question of the night for somebody writing in. Bonnie Rodriguez from Houston, Charles Finicum from Linda, Arizona, Cynthia Hendricks from Moreno Valley, California. Thank you all for being a part of this. Oh, we also have Kathy Figueroa. Hi, everyone from Chicago. What a great representation from around the country that we're having here. This is really good, and I'm glad to have you guys be part of things. And, J-Man from Australia, the best. Audrey says that it is cold tonight in East Tennessee. She hates the cold weather. East Tennessee, it gets cold there, doesn't it, compared to out here anyway. We have Jeanette Lakes. Hi from C.O. Carlo in Ireland. And I'm not sure if that's exactly how you intended to write it. Nellie's here, Nellie Kelly, and Siska Knoll from Indonesia. And we also have Raul Juarez from McAllen, Texas. Pawan Sa from Nepal. Wow, all over the place. Stephanie Seam from Colorado. And that is a great group. Now, as I get going, if you really need to get attention, you can always use Super Chat. If you're not an Apple product user, because Apple doesn't have the Super Chat set up, but it's where you have a little dollar sign by where you put in your message, but you don't have to. So with everybody here now and a couple minutes into it, actually we're kind of up on 3 minutes now, I'll start talking about residency. And the reason I'm talking about it is because of Dr. Green Knight's blog post. Those of you who subscribe to Dr. Green Knight, link in the description, you will know that today's blog post was part 3 of his describing his journey through college, medical school, and residency, finishing up with getting the job at Auburn Medical Group at the end of it. So make sure to see that. If you haven't already subscribed to it, there, again, a link in the description so you can find out. So I thought, since today's was so much about residency and the whole process, I would go ahead and complement that with talking about it here and answering questions that you may have if you actually read his blog. Also, people, please do put questions in the comments for after this, and hopefully we can get to those. Those of you who follow the comments may see I'm not answering as many as I used to. It's because there's a lot more coming in. I do read every single comment. I apologize for not being able to answer all of them. Okay, so back to residency. You can't talk about residency without first talking about the match, and Dr. Gwain talks about this in the post today, about his experience of going through the match. So I'll kind of give you my version of what Dr. Gwain wrote, going through the same steps. So, residency, the match process, brief explanation of the match. In the United States, for the most part, I mean like probably over 95%, people who are practicing medicine on patients have gone through some kind of a residency training for that. So that would be being in a hospital, usually, almost always, rotating through different areas of medicine related to their specialty, and often covering call overnight, and it takes a minimum of 3 years, and some of them as long as 5 years or more even, and then followed by fellowship if people want to specialize beyond that. The match to get into residency, you on your 4th year of medical school, early in the year, like around fall, winter, you're applying to the residencies and interviewing at different residencies that invite you to after you apply to them, and then ranking them in order of your preference to go to them. The residency directors are doing the same thing with the people who interviewed with them. They're ranking which ones they want. A complicated computer program takes all of the U.S. medical 4th-year medical students and people after that who are applying to residency who, for whatever reason, are getting in late. All of the residencies and all the different specialties, so you can actually apply to different specialty of residencies. You can apply to emergency medicine and family medicine. And the computer gives the best match it can to everybody who's applied, everybody who's involved, the residencies and the students. And whenever there's, it comes out even. Okay, it looks like we're back. Sorry about that. Oh, and also somebody said that they call them Arkansans, not Arkansawers in Arkansas. All right, back to where we left off. Oh, yeah, the match. So competitive residencies would be like orthopedic surgery and ophthalmology, ENT, surgical specialties more so than medical specialties. By medical, I mean internal medicine and subspecialties of internal medicine. Most of the subspecialties of internal medicine, you'd go through a general internal medicine program for 3 years first, then do a fellowship in pulmonology, cardiology, gastroenterology, neurology, I believe even possibly dermatology. No, dermatology usually just do a 1 year general rotation or internship or transitional year, or there's another term they use for that first year when you just kind of do rotations around, just getting that first year in of being a doctor, and then you get your license in whatever state you're in, your permanent license, and then start in earnest your residency in whatever it is. That'll be true for like, some anesthesia programs. I believe it's also true for psychiatry. They'll do a year of just kind of like a first year of internal medicine and then go into their psychiatry training. Interesting stuff, the way that people get a little bit of general background and then go into something more specific. My experience was emergency medicine. I got my 3rd choice. I really wanted to get back to California. My first choice was UC Davis. My second choice was Loma Linda, which is where Dr. Gwain went to medical school. And then my 3rd choice was University of Missouri, Kansas City, or Truman Medical Center in Kansas City, emergency medicine. My choices were all emergency medicine, even though I'm doing family medicine now. I considered strongly family medicine. And looking back at it, I think maybe that would have been a more appropriate choice, but hey, it is what it is. You learn who you are as you go, and I learned I'm more of a family medicine guy than emergency medicine guy. It took a while to get to it, especially since I'd already started that commitment to emergency medicine residency when I filled out my choices back in my winter of my 4th year, or maybe it was early spring, 4th year of medical school. Once you do that, it's awful hard to make an adjustment. It can be done, but you're already set up in a 3-year program that's counting on you, and you're one of 8 or whatever residents in that year. It's going to really be a hole in that program if you are not there to fill your shifts. So they don't let go easily. They can, and they will if they need to, but thankfully it wasn't something I had to do. So my residency, 3 years of emergency medicine at the hospital in downtown Kansas City, trauma center there. So we got a lot of good experience. Lots of trauma activations, lots of volume, always busy. We had great didactics. We had lectures weekly that we would actually attend when we were on other rotations. We'd get out of them and we'd go attend our emergency medicine lecture. When we were on internal medicine or cardiology or pulmonary rotations, we'd be doing their noon hour lectures. I think the surgical specialties had daily lectures also. I'm trying to remember back in my days of surgery rotations. So, lots of rotations. My second rotation, now this is where it gets different from Dr. Gwain's. I did not have laws protecting me from how many hours I was putting in. So, but I actually came out pretty good. I know people who had a lot worse off than I did, but my second month in residency, just a month out of being a medical student. Not quite, because medical school ended in May and residency didn't start until July, but a month of actually practicing as a doctor or being a resident. I did my pediatric surgery rotation. So pediatric surgery, operating on kids and babies at Children's Mercy Hospital in Kansas City. There were the surgeons who, the emergency medicine rotators. We didn't speak to them. We knew who they were. We tried to not let their shadow fall on us, and tried to answer their questions if they ever did actually speak directly to us. But there's a bit of a chain of succession. And so the ones that we were really dealing with, well, first of all, there was any other surgical residents who were doing a rotation on pediatric surgery, like a third-year surgery resident. They would be above us. And then above them were the fellows who were doing a fellowship. Now, these guys had already done a general surgery residency of about 5 years, and now they're doing a 2-year, at least, fellowship in pediatric surgery. So I believe it was a 2-year program. There were 2 fellows, one for each year. One of them was always in the hospital for those 2 years. Think about that. You're sharing a position with one other person, and one of you is always in the hospital for 2 years. So it would be a different person each year because it's just a 2-year program. And I may not know all the details of this, but this is how it looked like to me from my own experience coming through as just a resident rotating through. But these guys, like when one of them would go on a vacation, the other guy would pack his bag and move into the hospital for the week. And he was there. He could not leave the hospital because he was the one that would be called for anything, and he'd have to be there. Now, he would also call the attendings, but they would be at home telling them what to do, and they would come in if an operation had to be done. But for the most part, he was talking to them on the phone if anything came up that they weren't comfortable handling. That's how the training works. You've got somebody over you all the time. But these guys were always in-house. And over the surgery residents and the emergency medicine residents or whoever else would rotate through. And so this is what their schedule would be like. They would go to work. They'd work that day. Then they'd be on call that night. Then their partner would come the next day, and together they would both work and operate and do rounds the next day, and then they'd go home. So essentially, their life is always in the hospital except for every other night going home to their family, where they would probably just sleep because they probably would have had calls throughout the night. The rotation, as I was on it, I do remember having a single shift that lasted 36 hours with no sleep. I was continually doing something, answering calls with the beeper. It was back in the days of beepers. And you would be I was wearing 2 beepers. I remember that. One was for being on call, one was just for them normally to reach me, whatever patients I was following. And then the other one was for being on call for the whole service. I would get that. The fellow would also have one, and I think there was also a resident probably above me, but I was the first line. I was supposed to take care of all the little scut that would come up, admit new patients, check on whatever needed to be checked on, take calls from the nurses on the floors for anything that was happening, abnormal vital signs or lab value came in throughout the whole night on all the service. So 36 hours, come in at, whatever time in the morning, 7 in the morning, whatever, and then leave at 7 the following night, having worked straight through. There was one week where I logged 120 hours of being in the hospital working, but I did get sleep during that. It wasn't being awake the entire time. It was 120 hours of being at the hospital. And that was the worst of my entire residency, and it was my second month of it. I did have call and other rotations, but never worse than that. And that one is actually only every third night. That's not that bad. So on that worst week, that worst 7-day period, there were actually 3 call nights that contributed to that big. And then there's also a weekend. You cover weekends for each other, so that probably was a time when I had the weekend covering for whoever else was able to take off a day or the whole weekend, where I was actually seeing their patients. So that was more work, more rounding. Other rotations would include general surgery, ENT, orthopedics, and then the medical, I said before, cardiology, couple rotations, and each of the rotations is 1 month in length. Couple rotations of cardiology, pulmonary. We didn't do a GI. I can't remember doing GI. Did we do GI? I can't remember doing GI. Interesting. And then there's also some electives that you can do. And so one of my electives was to come out to California and do a month at, I'm sorry, I'm thinking of medical school where I had a couple of electives. I don't think I had any true electives in residency. It was just working right there. So we had a pediatric emergency department, we had an adult emergency department, we spent a lot of rotations there. Probably half the program was spent in emergency medicine, and the other half was doing all these other rotations. And then at the end of the third year, you graduate, you get a certificate, and you go off to the job that you got, because you finish up on June 30th, because you have to get out of there so that July 1st, everybody else can come up 1 year behind you and all the new ones come in. That's why if you go to a teaching hospital, you don't want it to be on the first week of July, because everybody is just starting to be in their new position because they graduated up a year between June and July in the teaching hospital. So we got some comments here. So is first year resident actually a doctor? Yes, you're a doctor as soon as you graduate from medical school. Finish up your fourth year of medical school. Connie says it's only 15. Retired RN, born where I moved here, less than 7 years. Clarksville, Independence. Talking about country out there in Arkansas and Missouri, it sounds like. And Butterfly Girl from Iowa. Don Moon saying hello. Ryan asking if I liked Kansas City. No, I did not. I liked St. Louis, though, when I was there for medical school. Lisa Smith, do all doctors need to do surgery? No, not all. The ones in the more general specialties, like family medicine and emergency medicine, I don't believe internal medicine, which is rather general too, do surgery rotations because they're internists. Video under 50 years heart failure. What exactly does it mean when a group has family internal medicine? When a group has family/internal medicine. Family medicine is primary care, first line for everything. Adults, children, some of them even do obstetrics and deliver babies even, gynecology. Whereas internal medicine, they're not doing any delivering of babies at all, no obstetrics. They may do a little bit of gynecology, and they don't do anything under age 18 or so. They don't do any kids internal medicine. And they don't do a whole lot of surgery. They may do some skin procedures or procedures with central lines, spinal taps, basic GI procedures like sigmoidoscopy, things along those lines. Dejane Leggett, love Dr. Gawain video also. Yes, we love Dr. Gawain's videos. Okay, so that is getting caught up on your comments. How often person have a checkup? After age 50, we recommend they come in every year. Before that, about every other year. If it's a healthy person with absolutely no health problems, maybe even stretch out a little bit during their young adult years. Kids, we like to keep kind of an eye on because they always have things changing and their body's developing, so we kind of like to look at them closer to annually. And then anybody who has an actual health problem or is prescribed medicines, we really do want to see them more often than that, because we want to have both general looking at how they're doing plus an appointment to focus on their whatever their health problem is and their medicines they're taking. Lisa's asks, so first year residents, actually doctor, yes. Sorry, this is my voice here. Connie Jaggers, do you enjoy city life and work in and fast pace than you do now? It was fun, but no, I don't want it. I don't want it at all now. I had my time, and now it's different. I enjoy spending time talking to someone I've developed a relationship with over the last decade, and taking care of them and helping them to maintain their health as they can, helping them get off of medicines by living a healthy lifestyle, seeing their families, change and grow. I get more out of that than the excitement of putting in a central line or intubating somebody, which used to be what I would enjoy more. It's just, people change over time, and that's how I've changed. So thank you so much, everybody, for being a part of this. This has been a good talk. I do encourage all of you to use the link in the description to sign up for Dr. Gawain's Dr. Green Knight blog. Sorry he didn't join us tonight. That's okay, though. He said such nice things about me in his blog. All right, one more for Butterfly Girl. How often do young adults, I'm 26, have to get a checkup? For women, we recommend up to age 30 getting in annually for some things to get checked that we don't necessarily do on men because there's some differences. So until next time, Dr. Mark Vaughan telling all of you to stay in good health.